Morning. Welcome to the class of 2026 graduating ceremony. I know it's a little bit warm in here this morning. The AC went down just in time for our second cohort that's used to kind of the things happening, adjusting, and moving forward. We'll go ahead and get started. Today's hooding ceremony celebrates the extraordinary journey of our graduating nurse anesthetist students, a journey marked by perseverance, sacrifice, growth, and unwavering dedication to the art and science of anesthesia care. These students entered the program with a strong foundation in nursing, and I will say that they were the best of the best of a couple hundred applicants, a calling to take their clinical expertise to the higher level. Over the past several years, they have been challenged academically, emotionally, and professionally. They've studied late into the night, cared for patients through complex procedures, navigated high-stakes clinical decisions, and proven their ability to deliver safe, compassionate care in the most critical moments. This hooding today marks not only the completion of a rigorous doctoral education, but also the transformation from student to certified registered nurse anesthetist. Each hood placed today represents countless hours of study, clinical hours, and the personal sacrifices, and there were a lot of personal sacrifices, made to fulfill a dream. It also symbolizes the trust placed in them by their patients, their preceptors, and the profession. As these graduates don their hoods, they carry forward not only knowledge and skill, but also the values of empathy, courage, and professionalism. They leave here not just as clinicians, but as leaders and advocates for quality anesthesia care. Today, we honor their journey and celebrate their future. With that being said, I would like to introduce Dr. Daines, our president, and he's going to say a few remarks. Dr. Daines.
Well, good morning, everybody. That's good, right? I mean, it's hot and it's sort of late morning. So I'm Gary Daines. I'm the new president at Mary Baldwin University. I wanted to thank you all for being here today. Students, thank you for the commitment, for the struggle, for the vision, for the passion, for the aspiration, for the hope that you have invested in us and in yourselves over these past years that has brought you to this day. Faculty members, thank you for doing the work to bring these students to this place, for finding the right measure of challenge and encouragement, test and support, vision and wisdom to help bring the students to this point. And all of those of you who are here today, thank you for joining us. It made me happy to hear you clapping as the students were walking in. This is a celebration. You should clap, whoop. Well, maybe not whoop. That sounded, it made more sense in my head than it. But clap, cheer, and celebrate the people who have accomplished so much today. Having been through a rigorous doctoral program myself in a different discipline, I know that it never happens by yourself. It can only happen with a community of support. So for those of you who are here today, thank you for being that community of support for the students who are graduating. You have done good, holy work on behalf of these students and through these students on behalf of the thousands and thousands of people who they will serve in clinical settings in the future. The last thing I'll say is, students, I know you may be wondering why it is that you have to wear robes that are warm in any setting, but particularly in this setting, and that you will then have a hat and a hood as well. And I used to be a history professor, so forgive me 2 seconds of history here. This dates back to the beginning of university study, when a graduate of a university wasn't always sure the path that they would go on. And so when they graduated, their faculty members gave them robes and caps and hoods to mark their accomplishment, to shelter them from difficulty, and to make sure that when they crossed paths with other people who had achieved what they had achieved, that they would recognize each other, and by recognizing each other, support each other in moments of difficulty and success. So as you are hooded later today, think about your classmates. Think about the thousands of people who have gone before you. You are entering into a community that will support you and stand with you through thick and thin, through success and challenge in the decades ahead. And because of your accomplishment this day, you will do that for people who come after you. So on behalf of all of the students, staff, and faculty of Mary Baldwin, and particularly on behalf of the students and the staff and faculty of Murphy-Deming College of Health Sciences, I say to all of you, welcome and congratulations.
Thank you, Dr. Daines, and thank you for coming this morning. Next, I would like to ask Dr. Talbot. She is our Vice President and Dean of Murphy-Deming Health Sciences to come up.
Boy, it is wild up here with that light shining at you in the dark, but good morning, everyone. You know, as Dean and Chief Nurse Administrator at Murphy-Deming College of Health Sciences, it is really a privilege to be able to celebrate this accomplishment with you today, and to recognize how much it took for you guys to get here. You know, you're going to hear it over and over, but you guys are only the second graduating class from our CRNA program, and when you arrived, only 25 students had come before you, and they had completed only their first year. You took a chance on a new and growing program, and we are really grateful that you'd placed your trust in us. But being among the first cohort meant that you had a unique role in shaping the program. There are things that we did well, and there are definitely things that we could have done better. You shared your experiences with us, and we listened, and we continue to make changes as part of our commitment to continuous improvement. Your feedback has made the program stronger, and it will benefit every cohort that follows you. So you might not have realized it at the time, but you were already making an impact on the future of CRNA education and the profession itself. And so I personally want to thank you for that. And just as you helped our program grow, we've had the privilege of watching you grow. Each of you guys came in as an experienced clinician. Most of you guys registered nurses in the ICU, but I expect that you guys quickly discovered that there's a difference between moving from that registered nurse role to an advanced practice provider role. So over the past 3 years, you've gained an incredible amount of knowledge, skill, judgment, and confidence, and you've also made significant sacrifices. You gave up income by not working, you missed time with your friends and family, and you studied when you were tired, and you showed up when the things got difficult, and you kept going. There's people in this room that also supported you, and they made sacrifices also. Your spouses, your partners, your children, your parents, your siblings, friends, everyone else who helped you reach this day. And so we want to acknowledge them too. This accomplishment belongs to you, but I also know you didn't get here alone. You had the people around you. So you should be very proud. CRNA programs are really highly competitive. They're very intense and demanding, and you made it. I know many of you already have jobs waiting, and I know you're eager to sit for your certification exam, right? And start your clinical practice. But this is the humbling part. Although you've entered this program as an expert registered nurse, you're about to become a novice again. And that can be exciting, but it can be a little scary too. So one of my favorite nursing theorists, and you guys are going, oh my God, she just said nursing theorist, but is Patricia Benner. And you guys might remember from your classes about her novice to expert theory. And what that does, it reminds us that your clinical skill and judgment develop over time through real world experience. It doesn't happen by just your education. So today, you're going to begin that journey towards expertise again. The new letters behind your name are not proof that your learning is finished. They are a reminder that this new kind of learning is just beginning. So I want you to find a mentor, ask questions, look for opportunities to try new things and expand your skills. But be humble enough to admit when you don't know something and confident enough to keep learning. So when you leave Murphy Deming and Mary Baldwin today, your connection to the program doesn't end, and neither does your education. This ceremony is not simply a finish line, but it's the beginning of the next stage of your professional journey. So once again, I want to say congratulations. We are so proud of what you've accomplished and grateful for the impact you've already made. And I am so excited to see the clinicians and the leaders and the mentors that you will become. So I want to take a minute and introduce our faculty and just recognize their contribution to the program. And I'm going to ask that you stand when I call you. The first is Dr. Jen McPherson, our program director. Dr. Kelly Elmore, our assistant program director. Dr. Gerald Wallace, director of clinical education. Dr. Barbara Cord, who made it by the skin of her teeth, director of simulation. Dr. Chris Simmons, principal faculty. And Dr. Mike Miller, principal faculty. Thank you.
All right. Next, I have the honor of introducing our class president, who is also going to be a speaker for today. She has been an amazing class president. She has done so much for me to get stuff out to you guys. She has been an ear to the ground for me. She has kept me in the loop of things that I need to know and need to do. She was a great asset on recommendations and things we can do better. And she has been a leader all around for everything that has happened with your class. I appreciate her so much. And Ashley Nelson, could you please come say some words?
Good morning, faculty, friends, family, and most importantly, the class of 2026. Incredibly, we have made it to the end of this very long journey. And even though we don't remember when we last had a full night's sleep, we are somehow still standing and now with diplomas in hand. The experience of CRNA school is so difficult to explain to someone else. It's being thrown into an emergent crane and answering questions about the soda lime equation while actively intubating, and then remembering you have 2 exams and a paper this week. It's cramming in another APEC study session between cases and then dragging yourself home to care plan after dinner. It's learning to explain to our family and friends why we have to miss another birthday dinner or night out. It's realizing that I studied for this and I feel ready for this are 2 incredibly different emotions. And we learn to walk into the room anyway, every single time. But somewhere between the 4 a.m. clinical mornings and the endless case logs, we became much more than just classmates. We became people who show up for each other. Not because we had to, but because that's who we are. And it's who this profession asks us to be. Anesthesia is a job built on trust. Trusting your training, trusting your team, trusting that the person next to you has your back when it matters the most. And we built that trust with each other first. Over the past 3 years, we have trusted one another with much more than just study notes and practice questions. We've trusted each other with honest feedback, with clinical advice, with encouragement at the end of difficult days, and reminders that we would in fact survive the next exam. We became the people who say, "You've got this," while quietly wondering if we ourselves had it. We have seen one another grow, not just in skill, but in confidence and in character. We have learned that competence is essential, but so are kindness and patience and knowing when to ask for help. We have learned that the best teams are not made of people who never struggle. They're made of people who show up when they are. And that is exactly how we got here today. To our faculty, our preceptors, our family, and our friends, thank you so much for trusting us before we fully trusted ourselves. Your guidance, sacrifice, patience, and belief in us have carried us farther than you know. And to my classmates, I have never been more honored and humbled to represent a group of people. I am so proud of and grateful for each and every one of you, and I know I would have not made it here today without you. You are all incredible anesthesia providers, and I will always be proud to be a part of this class. Today, we graduate with the knowledge that we can handle almost anything, especially with a good team, a solid plan, and plenty of coffee. So congratulations, classmates. We did it.
Thank you, Ashley. You are a great example. And I appreciate you very much. Next is the part that many of you have been waiting for. I am going to ask Dr. Gerald Wallace to please come up to the podium to announce each person's name, and Dr. Elmore to come help with the hooding.
Where they coming from? Where they coming from? For the first time, Dr. Shabri Almeida. No. Dr. Amanda Almonte. Dr. Troy Bolden. Dr. Marcus Bowen. Dr. Donathan Bryant. Dr. Allison Burks Paysauer. Dr. Damon Duarte. Dr. Hannah Duffy. Dr. Nequation Edgiston. Dr. Montserrat Fuller. Dr. Adam Gold. Dr. Elizabeth Hassani. Dr. Landon Horton. Dr. Cassandra Keefe. Dr. Daniel Lloyd. Dr. Gabriella Miskell. Dr. Ashley Nelson. Dr. Danielle Parker. Dr. Haley Schilling. Dr. Haley Schaefer. Dr. Bria Sherrod. Dr. Myra Williamson.
Oh, that is so nice to see. It's so exciting. Yay! Next, Dr. Talbot is going to come up and do some award presentations.
They're in order here? Yes. Okay. Just making sure they're in order so I don't screw anything up here. So it is, I'm like Dr. McPherson, it is so wonderful to see all of these new freshly minted doctors sitting out in the audience. So our first award is the Didactic Excellence Award. And this award recognizes students who have demonstrated exceptional academic achievement, intellectual curiosity, and strong commitment to mastering the art and science of nurse anesthesia. This year's recipients are Allison Burks Paysour and Landon Horton. Throughout their studies, Allison and Landon have distinguished themselves through their ability to integrate complex knowledge, think critically, and apply concepts through precision and insight. These strengths will serve them well throughout their careers as nurse anesthetists. The Agatha Hodgins Award recognizes a nurse anesthesiology resident who exemplifies academic excellence, clinical competence, professionalism, leadership, and a commitment to safe, compassionate patient care. These qualities reflect both the accomplishments and character required of an exceptional certified registered nurse anesthesiologist. This year's recipient is Ashley Nelson. Throughout her education, Ashley has consistently pursued excellence in the classroom and clinical setting. She integrates knowledge with sound clinical judgment while demonstrating the vigilance, adaptability, and attention to detail essential to anesthesia practice. She approaches every challenge with determination, professionalism, and a genuine desire to grow. Ashley has also distinguished herself through leadership and service. As class president, she represented and advocated for her fellow residents while fostering a collaborative, supportive learning environment. Her involvement with the state nurse anesthesia organization further demonstrates her commitment to professional service, advocacy, and the future of the profession. Equally meaningful is the respect and compassion Ashley shows to her patients, faculty, preceptors, classmates, and colleagues. Her resilience, humility, perseverance, and willingness to learn reflect the values at the heart of nurse anesthesia. Agatha Hodgins was a pioneer whose vision and leadership helped shape nurse anesthesia into the profession it is today. So it's fitting that an award bearing her name recognizes a resident who has pursued excellence while choosing to lead and serve others. The Nancy Morse Evans Leadership Award was created in 2017 through the generosity of Nancy Morse Evans MBU class of 1970. This award recognizes a Murphy-Deming College of Health Sciences graduating student from each of the disciplines represented in the college who demonstrates academic excellence, clinical distinction, and a record of service and leadership while in their program. This year's recipient for the Doctor of Nursing Practice program is Donathan Bryant. The Rabinowitz Pharmacology Award is funded by Stephen Rabinowitz, CRNA, class of 1994 at Central Connecticut University. This award honors the memory of his grandfather, Abraham Rabinowitz, Philadelphia College of Pharmacy and Science class of 1908, and his parents, Howard Rabinowitz, class of 1948, and Esther Sev Rabinowitz, class of 1949. It is presented to the two students who earn the highest grade point averages in advanced pharmacology. This year's recipients are Ashley Nelson and Daniel Lloyd.
And can you recognize him in the audience? Can you recognize him in the audience?
Yes, this is yours. And I do want to recognize, I can't see with the lights, but I do want to recognize Stephen Rabinowitz, who is in our audience. So if you would. He has been a tremendous support to the CRNA program and the School of Nursing. And going on, we also have the Rabinowitz Clinical Preceptor Award. And our CRNA program would not be possible at all without the commitment of our clinical preceptors. At clinical sites across the region, hundreds of our CRNAs generously share their knowledge, experience, and time to make our students' clinical education possible. Funded by Stephen Rabinowitz, the Clinical Preceptor Award recognizes two outstanding preceptors selected by the senior graduating class. This award honors not only clinical excellence, but also the invaluable gift of mentorship. These preceptors go beyond teaching clinical skills. They model compassion, professionalism, and integrity in every patient encounter. Through their dedication, they help shape the next generation of CRNAs and leave a lasting impact on our students and the patients they will serve. It is with deep gratitude that we present this year's Clinical Preceptor Awards to Jap Prayer of the University of Virginia Hospital and Radar, Scaboloni of Novant Forsyth Medical Center. Thank you both for your exceptional contributions to clinical education and patient care.
Next, we are lucky enough to have Vanna's president with us, or president-elect, soon to be president with us, to hand out to each of you a small gift and token from Vanna. You have them? In the back.
I'll just say a few brief words. Ladies and gentlemen, faculty, proud families, and the class of 2026. My name is Christopher Simons, and I'm honored to speak before you today, both as a certified registered nurse anesthesiologist, as the president-elect of the Virginia Association of Nurse Anesthesiologists, and as a proud faculty member here at Mary Baldwin. Today is not just about receiving diplomas, it's about embracing a calling, a responsibility, and a privilege to step into this honorable and amazing field of nurse anesthesiology. Before you do, I just want to ask you one question. Do I want a job in anesthesia, or do I want to become a member of the anesthesia profession? This question is not just a choice, but is it a compass that will help navigate your career going forward? There's a profound difference between a job that has tasks and responsibilities and a vocation founded upon a specialized education with the purpose of delivering expert care, and counsel in the service of others. On behalf of the Virginia Association of Nurse Anesthesiologists, I, along with our fellow board members, am proud of all of your accomplishments and the unique potential that each of you carries forward today. These marks not only the culmination of years of hard work, but also the beginning of a career that will touch countless lives. As a small token of our appreciation, we've included a gift for everyone here to celebrate your achievements, and that you are now part of a proud and enduring profession.
All right. As we conclude today's hooding and graduation ceremony, we honor not only the academic achievements of our graduates, but the spirit, the resilience, compassion that they have known throughout their journey. The hoods they now wear symbolize their transformation into doctoral prepared nurse anesthetists, leaders in clinical excellence, patient advocacy, and lifelong learning. Today marks both a culmination and a beginning, a culmination of tireless dedication and a beginning of impactful service to patients, communities, and our profession. We extend our deepest gratitude to families, friends, faculty, and mentors whose unwavering support helped make this moment possible. Dr. Daines, again, thank you for joining us today for this ceremony. And I want to personally thank those of you in the class of 2026. You have been so supportive of our program, our school, our faculty, and of me, and I appreciate that. I know it has been a long 3 years, but your patience and support as the second cohort does not go unnoticed. And finally, but by far not the least of anything, this program would not have run without Mrs. Leslie Edwards. Thank you, Leslie. She skipped breakfast to be here this morning. So, congratulations to the Doctor of Nursing Practice, Nurse Anesthesiology class of 2026. Go forward with pride, purpose, and power to make a difference. And don't forget to come to the front when we're done.